So good morning everybody. Before going to the pharmacodynamics and kinetics about these drugs, we will first understand how we can administer the drugs. Okay. So today we will be understanding what are the different routes of administration and which method is good for various drugs. Okay. So starting with major routes of administration, mainly we can classify them as enteral route, parenteral route and topical routes. Okay, inhalational, transdermal, these are the newer routes of administration. Enteral, that is directly into the GIT or gastrointestinal system. We have oral, sublingual and rectal routes. In parenteral routes we have intravenous, intramuscular, intra-articular, intrathecal, intramedullary, intra-articular, subcutaneous and intracardiac, epidural. Many routes are there for this administration. So you might be familiar with these terminologies, but you need not be knowing some of the important points where we need to concentrate, which route is for what. So coming to the oral route. So oral route, is it good? Yes. So we will be understanding and comparing each other routes by various good points what we need. So any drug, it should be it should be cheaper? Yes. So it should be cheaper, it should be palatable? Yes. It should be easier, palatable. Do we need to sterilize all the drugs? May not be for the drugs which are given by oral route. Okay, so sterilization will involve lot of cost. So any drug which can be administered other than this oral route, or which should be administered other than this oral route, that is the parenteral route, there the process of sterilization takes place, and where it is needed, the cost of the production will increase. Naturally the cost of the drugs will increase. Okay, so then it should be once we are telling it as oral, so it should be palatable. The patient should be comfortable. Okay, so what happens if it is a drug with bad taste, metallic taste? Most of the antibiotics have. There will be patient compliance will be less. What happens if the drug need to be taken for every 2 hours? The patient's compliance will be less, because he may not be remembering it. Even though you want to take it, sometimes it becomes difficult for him to take the drug more frequently. Okay, so the drug should be relatively longer acting also. So there are various points we need to remember based on this. Okay, we'll be shifting first to the oral drugs. So is it the commonest mode of treatment? Yes, it is the most commonest. Why it is safest? We are not poking his skin, or we are not poking his body with any injections or anything. So at the first point, the drug should be, even at the time of administration, it should not cause cumbersome to the patients. Okay, so that should be the point, like intramuscular, intravenous injections. You might have seen nurses poking the patient's skin so many times in order to get correct IV access. So that is not there. Is it convenient? Yes, it is convenient. If you tell the patient to take the drug at particular time, he can take it. Is it possible with the intramuscular subcutaneous injections or in other routes? It is not possible. It is less convenient because he needs the help of the other persons to carry out such business. Okay, so is it painful oral? No, it is not painful. So cost effectiveness? Yes, it is less cost. It is costing less because less sterilization, and even now we have the drugs which are sold for less than 1 rupee. Okay, so we have some antibiotics, antipyretic agents which are costing less than 1 rupee. Sterilization, as I told, there is less need of sterilization. Less adverse effects compared to parenteral route. Yes, why is it so? The drug which can cause the adverse effects immediately are those drugs which directly enter the systemic circulation and their concentration is very high at the plasma. Is it attained with the oral drug immediately? No, it is only with the parenteral routes such as intramuscular, intravenous or any other routes where the higher concentration can be attained within 1 arm circulation time, that is less than 15 seconds or so. So that is not there with this drug. So can we give large volume of the doses? Can we give larger doses? Don't think the tablets as the only means we are giving this drug. Can we give larger doses of the drug? Yes? Yes. We can give large doses of the drugs. Okay. So, for example, it may be oral rehydration solutions. How much we can give? We are giving it at the rate of 500 to 700 ml per 6 hours, something like that. The proportion is very high. The larger doses can be given to the patients. Okay, that need to be remembered. And can we use it for both systemic and local effects? Yes. So oral drugs can be used for local effects. Think of lozenges, after seltzer solutions. Okay, they are for local effects. Okay, but we also have the majority of the drugs which are swallowed up. Those are the drugs which can cause the systemic effects. Okay, so for local effects, that is neomycin, local aminoglycoside, that is given. Then antihelminthics, anti-amoebic drugs which are less absorbed and they have their luminal action and kill the parasites. So with oral route we had so many advantages. So can we have disadvantages with this? Yes, there are disadvantages or demerits to that. That is mainly due to the lower bioavailability and slow absorption rate, which is not possible to take the patient to the good state within short duration of time. For example, a patient needs immediate attention, we cannot give the oral tablet. Okay, a person is suffering from myocardial infarction, you need a intravenous access immediately, or else you will not be able to save the patient immediately. Okay, so in such conditions, emergency conditions, this route may not be of that help. Absorption varies, delay, decrease or increase. Okay, the food can decrease the absorption. Most of the drugs which we give by oral route are gastrointestinal irritants. Okay, so if they are irritants, what can happen? Sometimes due to gastric acidity there can be gastric ulcers also. Okay, that is there. And if the food is impeding with this absorption, then it is bad. Okay, and to prevent this gastric irritation, what we tell? We tell the patients to consume these drugs after the food. But after the food, there can be absorption can be varied. Okay, so that is there. And there are drugs which decrease or increase the intestinal motility. Have you heard of organophosphorus poisoning? Yes, these farmers, they consume this pesticides, insecticides. Once their crops have failed, there are a lot of deaths. Have you heard these things? Yes, on the papers you might have read it. So what do they try to consume? That is the pesticides and insecticides. These commonly are the organophosphorus compounds. These are the cholinergic compounds. Just remember, cholinergic compounds, and these are organophosphorus compounds. They can increase the GI motility. Both tabs are open, upwards, downwards. So you can present you with vomiting and loose stools will be there. Okay, and we have certain drugs which can decrease the intestinal motility. These are the opioid group of drugs. Okay, opioids, have you heard of this? Heroin, morphine, abuse drugs. These can cause constipation, and we have used them for our benefit by modifying their action in constipation. So dose may not be accurately delivered because it may be food, it may be first pass metabolism or any other thing. Irritation of the gastric mucosa. Yes, I told most of the antibiotics which we use orally, they can cause this GI irritation. Patient compliance is not ensured. Yes, antiviral drug acyclovir, we need to administer it at least 5 times daily. Is it compatible? Is it good for the patient? Like patient compliance will be very less because as the frequency increases, the patient may not be in good condition to take it. Okay, the goodwill will not be there. He might forget some things. So first pass metabolism or pre-systemic elimination, yes. What happens? The drug can be converted into inactive form, or the amount of the drug reaching the systemic circulation can be decreased, bioavailability can be decreased. So the first pass metabolism is greater the first pass metabolism, less will be the bioavailability. So can we give it in unconscious patients? No, we cannot give in unconscious patients, uncooperative patient is vomiting. We cannot think of this route. Emergency, no way. Okay, so following drugs cannot be given. What are those? Those drugs where the GI acidity or the stomach pH, which is around 1 to 3, that pH will decrease its bioavailability. That is benzyl penicillin, that cannot be given. So what are the peptides? Orally given peptides cannot be there because these peptides can be digested. Okay, we have this insulin which cannot be given by oral route. It is destroyed by the intestinal enzymes. So hydrophilic drugs which cannot be absorbed, such as neomycin. So of course we are using such properties for our advantage, but such other drugs cannot be used. Drug interaction is there. Okay, for example, if milk is taken with this tetracycline, or an antacid is taken along with tetracycline, what happens? Their bioavailability decreases. Coming to the next route, that is the sublingual route. What do you understand by this term, sublingual? How much is the sublingual space? So I am just giving this hint just for you to think over or ponder over that what may be the demerits of this. Sublingual space is large or small? Small. Can we use large amount of drug? No. Okay, and if we cannot use a large amount of drug, what are the advantages which are prompting us to use this route? Okay. Okay, so here what is happening? There are sublingual veins which are helping in direct absorption of the drug directly into the systemic circulation, bypassing the first pass metabolism. Okay, so it is useful in emergency, maybe like angina. Okay, we use the anti-anginal drugs, that is nitrates, glycerol trinitrate, nifedipine. Okay, nifedipine is used as an antihypertensive drug. It is a calcium channel blocker, and ergotamine, it is ergot alkaline, used in cases of migraine. Okay, so we have 3 different diseases where they are the emergency conditions where this sublingual route is helpful. What happens directly from the sublingual veins? It directly enters in the venous system, thereby directly into the complete systemic circulation. It is bypassing this enterohepatic circulation and also first pass metabolism. Here, if it is a tablet which can be crushed over, and we need to spread it along the buccal mucosa, that is there. Okay, and also this nifedipine jelly-like tablet, we just poke a needle into it and place it sublingually. Most commonly, we previously used to do this for pregnant patients. Okay, pregnant on the table for delivery, if she is blood pressure has increased, there we were using it. And here the effect can be terminated by spitting out. Is it good? Yes, because just now I told we are using this drug in cases of angina and hypertension. Okay, if the blood pressure is falling down, which is appropriate for our requirement, we can just spit out the drugs and decrease its further absorption. Okay, that point is there. Do we need sterilization? Okay, sterilization is not that much required, because orally or any other enteral route, orally, rectal, or this sublingual route, there are local factors which have some antibacterial action, and also when it is not injected directly into the systemic circulation, the sterilization may not be that important. Okay, So that is one point. First pass metabolism is bypassed. Okay, it is directly entered in the systemic circulation. It is bypassed. So first pass hepatic metabolism is bypassed, means bioavailability will naturally increase, and it is not affected by gastric acidity and intestinal enzymes because it is not at all entering that route. What may be the demerits now? Yes? Next. Irritant drug, unpalatable drugs, oral ulcers are there. Can you use this? What else? Can the drug be swallowed even though it is given sublingually? Are there any chances? Yes? Yes. Keep this idea in mind. We will go to it. So it is inconvenient for frequent use. Okay, frequently you need to use this drug. This route may not be helpful. Okay, sublingual lozenges, they can sometimes cause ulcerations in the sublingual surface area. Irritation of the oral mucosa and excessive salivation may be there, which prompt the patient for swallowing the drug rather than keeping it sublingually. Promotes swallowing, so losing the advantage of passing the first pass effect. Patient compliance is not ensured. Every patient may not be of that temper to keep it and wait for the drug to get absorbed. Not suitable for large doses and for vomiting patients. Bitter irritant drugs cannot be given. Have you heard of this route, rectal route? Yes. What is the basic idea? Yes? Yes, very good. One is unconsciousness. We can use it. Yes. Frequent vomiting is there. Okay, you are attempting, but still you are not getting the exact words which has to be put. Allergic drugs are allergic orally, sublingually, and also rectally. Yes. Is it cumbersome? Does the patient need assistance? Yes. Does it require some skills? Yes. Okay, keep this ideas. It can be used for producing both systemic and local effects. Yes. Because local effects for purgation activity. If the patient is not past the stool for some time, like 2 days, 3 days, there is constipation, we use some suppositories, some laxative suppositories where it can increase the secretions in the local area and cause the purgation. Okay, that is there. Here what you are seeing are Dulcolax suppositories, okay, which can be given intrarectal. So the drugs are irritant to stomach, they can be given by suppository. Aminophylline, have you heard of this drug? This is just a drug for asthma. Okay, it can be cardiac asthma or respiratory asthma. We can use this drug. It is basically a stimulant drug which can increase the heart rate, blood pressure, all these things. Just remember, it's a ionotropic drug. Suitable for in unconscious vomiting, motion sickness. Have you heard of this term, motion sickness? Yes, the persons after going uphill or at high altitude, they will have this ringing sensation and vomiting sensation will be there. Migraine. In migraine, do we have vomiting? Yes. So migraine, the patient will be having vomiting, he will be irritable. So we can go for this drug. When the patient cannot swallow and the cooperation is lacking, okay, there we can go for this. But actually, practically, where do we use this system is in cases of infantile spasms and infantile seizures, febrile seizures. Okay, we commonly use this rectal route for febrile seizures where we can save the patient's life. Okay, so the patient will be having jerky movements, okay, the jerky movement is there, very high fever is there, and you need to stop this epileptic attack which is going on in the children, okay. So this is the best method, okay. Go for intrarectal, take ampule of diazepam, dilute it to about 10 times, 1 ml, dilute it to about 10 times, take a cotton, okay, cotton gauze, pass it to the rectal route, push the syringe into it, okay. So there will be local absorption of this drug, okay. You cannot inject there into the rectal, okay. We are putting a cotton gauze and diluting this diazepam about 10 times, okay? This will be a common thing which can be life saving. So what may be the demerits? One is cumbersome. Then can there be good amount of absorption as we are expecting intravenous or intramuscular? The absorption may be erratic. Okay, keep this idea. Do we require enough sterilization? That is not there because just we are not entering the systemic circulation directly. So sterilization may not be required. Minimal skill is required compared to the intramuscular and intravenous route. Some skill is required, but minimal skill. Okay, so 50% avoid cases we can avoid this first pass metabolism because the route which we are entering is different. Okay, there is directly mucous membrane exposure where it gets absorbed into the systemic circulation. In case of this proctitis and colitis, we can use it to decrease the local inflammation. Okay, so demerit, the patient may not feel good. Okay, psychological benefits are less. Patient may be embarrassed. Okay, he needs assistance. It is not possible always in case the person is away from the house. So like irritation of the mucosa, inflammation on repeated use, that is there. Okay, so if you have some irritant drugs, maybe any other drug, but if the route is commonly used, the mucosa can get irritated. Absorption is unreliable, yes, because if the fecal content are there up and the drug cannot reach the enough surface of the mucous membrane, what can happen? The absorption will not be that much correct, and there can be erratic absorption. Like for movement, there may not be absorption. After some time, there may be more absorption. That erratic nature can be there with this rectal route. If the rectum is full of feces, then also there is problem with absorption. So coming to intravenous route. Is it cheapest? No. Do we require sterilization? Yes. Very high degree of sterilization is required. Can we introduce large volumes? Yes? Yes. We can introduce liters of intravenous solution. It is possible. Okay. If the patient is having hemorrhagic, he is in hemorrhagic shock, we need to replace the blood, we need to replace the fluids, we can be giving up to more than 2.5 liters per day. Okay. So large volumes are possible. Yes, what are the demerits of oral route did we discuss? First pass metabolism. No first pass metabolism. Emergency patients, yes. Unconscious patients, yes. Vomiting patients, yes. Okay, so what are the demerits we discussed along with this oral route? All are taken care by this route. Okay, so what were the merits of oral route may not be there with this. Okay, we'll be learning it now. Okay, rapid onset of action. Yes, there is rapid onset because the blood, it can reach the systemic circulation in the heart within 1 arm circulation time. Okay, so no first pass effect. Bioavailability is 100%. So amount of drug required will be more or less. Less amount of the drug is required because we are avoiding this first pass metabolism. Okay, once we avoid this first pass metabolism, we know what concentration we require at the systemic circulation. So even if 10 milligram is required, we can directly introduce 10 milligram. But if it is an oral route, we can go for 1/10 of it as observed is 100 milligram. So drug given is less. So though more accurately delivered. Yes, because directly into the systemic circulation, no other deviations, no other interaction with the food. Okay, it gives effective and highly predictable blood concentrations. Suitable in vomiting, motion sickness, migraine, unconscious patients, and when patients cannot swallow, maybe injury or maybe the person is having aspiration, where we have introduced a nasogastric tube or respiration, artificial respiration. In all these conditions we can do. Large volumes can be given. It was one of the advantages with oral route. It is same with our intravenous route also. Large volumes are possible. Yes. Coming to the demerits. First thing we need to remember is sterilization. Adverse effects. When we were discussing about oral route, we told the absorption will take sometimes the side effects or the adverse effects may not be immediate. Yes, the advantage of this intravenous route is faster, immediate action, but that can be a double-edged sword. Okay, it can injure the person also. How it is possible? Because if the drug is contaminated, if some particles are there still which are not completely dissolved, or if any allergic substance is there, pyrogen is there, okay, what can happen? Immediate allergic reaction and patient can die within minutes. Okay, that is there. So it is costly. Why it is costly? Because it needs rigorous sterilization. Okay, and inconvenient because is it painful? Yes, it is painful. That too with untrained doctors and nurses. Okay, so it includes the class also. Okay, have you entered the postings? Injected? No. Okay, don't make it more inconvenient to the patients. More chances of adverse effects? Yes, because of immediate effect. More dangerous? Yes, because of its immediate effect. Maximal sterilization is there? Yes, maximal sterilization is required. Skill is required? Yes, we need to enter the vein, seeing through the skin. Okay, so there is some skill needed for this purpose. Here you can see the intramuscular injection directly going to the muscle. The needle tip is here. Okay, coming to subcutaneous, you can see here it is going up to the subcutaneous fat. Intradermal, it is just going below the skin. We will have this slides again. Then, if the drug is too irritant, for example, the anti-cancer drug, very irritant group of drugs, they cannot be administered by this route. Okay, we are giving it by intra-arterial route. So it is either by oral or intra-arterial route we are giving our cancer drugs. So chances of levocal venous thrombosis, yes, if you are not entered the vein there and you have punctured it, what can happen? The blood can extravasate there and cause a local venous thrombosis. You might have come across this. Soon you will come across if you have not seen. So chances of local venous thrombosis is more. Infection is common. If the IV cannula stays there for more than 3 days, there is always a chances of infection. So because to keep this IV cannula intact, we need to administer some antibiotics regularly. Even though person requires only fluids, still as the cannula is there an external agent, we need to give some antibiotics for the patients. Yes, intramuscular route. Why it is needed when intravenous route is there? Any answers? See, compared to intravenous route, intramuscular is easier or difficult? Easier. Okay, that point is agreed. Then compared to this intravenous route, intramuscular route is faster or slower? Slow. We are not entering the vein directly. It is going to the lymphatics, then into the systemic circulation. Is it slow or fast? Slow. So chances of adverse effects will be immediate, or you'll get some time to. Some time is there. Yes. These are the advantages here. What may be the disadvantages? How many liters we can infuse? Intramuscular. How many liters? Yeah? It is just 5 ml. Not more than 5 ml. It is not in liters. Okay? So is it good or bad? Can we give IV fluids by intramuscular route? No. So large volumes are not possible. Maybe some drugs which can be given in small volumes, that can be given. Is it painful, or intravenous is painful? With the trained hands. A trained nurse is there. Which is painful? Intravenous is given by hypodermic needles with perfect angulation, and veins do not have the cut receptors. If you cut a vein, there is no receptor there. So now tell me, which is more painful? Intramuscular are painful. Okay, intravenous, if you are good, trained well, then it should be painless, except for the patient should know that something is happening, but it is a painless procedure. Okay, some pain can be there, but the veins have the stretch receptors but not the cut receptors. Okay, if you cut a vein, there should not be pain. Okay, that point you need to remember. So what are the sites where we can do? Deltoid and gluteal region, these are the most common sites. And does it go deeper than the intravenous route? Yes.